Hi, my name is Libby. I'm a first-year doctoral student in Wright State School of Professional Psychology. Before I get started, I wanted to point out that throughout my presentation, there will be a QR code in the bottom left of each slide that will take you to my full poster if at any point you want to look at that. I also will have QR codes to my full poster and references on my last slide. With that said, I will be presenting on a literature review that I conducted on the intersection between concussion treatments and socioeconomic considerations to highlight the need for research that accounts for diverse populations and addresses current disparities in care. Before I talk about that, it is important to understand what concussion treatments currently look like. A concussion is a mild form of traumatic brain injury that has been estimated to account for 75 to 90% of all reported brain injuries. Historical treatment approaches, such as recommendations of rest or avoidance of activity and stimulus, were based on precautionary principles rather than treatment studies or clinical trials. Some of these approaches have even had the potential for prolonging recovery or other negative consequences. Current concussion protocols for sport-related concussions involve returns to activity after 24 to 48 hours, but nutritional supplementation and cognitive therapies are also being reviewed for their effectiveness and efficacy in this treatment. The issue with this is that most concussion treatment studies fail to consider the ethnicity, socioeconomic status, or other social determinants of health of their participants and how they might impact treatment outcomes. The current literature has also primarily been conducted in specialty clinics with predominantly well-off white families, lacking the generalizability to more widespread populations who may not be able to afford the same treatment. In fact, in 2024, Cook and colleagues reported that 61.3% of concussion treatment studies excluded participants based on demographic, sociocultural, or health-related factors. They also found that no studies in that literature review examined the domains of economic stability or neighborhood and built environment. Additionally, no study examined health equity or disparities directly, and only one study described health disparities at all. Based on these findings, the current research on concussion protocols does not appear to include support for the efficacy of treatments and rehabilitation strategies for those who are underserved or underprivileged. With this in mind, there's a large gap in the literature surrounding the interplay between social determinants of health and their impact on concussion treatment and recovery for those in marginalized populations. So, if it wasn't already obvious, these gaps should be addressed. Future studies should look to expand the existing literature in order to explore the effectiveness and efficacy of current concussion treatment protocols for marginalized populations. They should also seek to create more accessible protocols, such as ones in other languages or ones that are cheaper to access. It may also be beneficial to examine whether or not social determinants of health are implicated in specific mechanisms of injury, such as concussions related to a fall, fight, abuse, or other ways that a person might get a concussion. Thank you so much for listening to my presentation. If you want to see my full poster or references, feel free to scan the QR codes or reach out to me with any questions you might have. Have a great day!